Okay, so after broadly looking
Yes.
at what is bacteria, it is classification, we want to start narrowing down now to medically important bacteria, and we'll do it based on the principle of gram staining as a way of, and when you talk of gram positive bacteria, those are bacteria that stain blue because of the primary stain we call crystal violet. All the bacteria, you will hear them being called gram negative. They stain with a secondary stain called a neutral red. Neutral red. So when you talk of gram positive cocci, of course, these are bacteria that are round in shape, and they also stain blue. Number one bacteria that we want to look at, which is most importantly pathogenic to man, is what we call Staphylococci bacteria. This bacteria is a gram-positive cocci that is round-shaped and stained blue, and most of the characteristics shows that they don't they don't move, they are non-motile, but they appear in like what you call grape like clusters. They appear together in clusters or clumping. They don't form spores, and neither do they form capsules. They are not non-encapsulated, apart from few. These bacteria are aerobic. They grow in the presence of oxygen, but sometimes they are facultative anaerobes, meaning they can grow in traces of CO2. Most of the strains under this Staphylococci bacteria, they are heat stable. You can, if you have food up to around 60 degrees hot, they can as well survive up to that level. So those of us who rush with the food and warm a bit and you think is now safe to eat, now you are being told no, this bacteria can be stable. This is um, more of this Staphylococci is a genus. It has several species. Most important species under this Staphylococcus is like Staphylococcus aureus. Um, we say they are coagulase positive. It means they are able to clump, to react and agglutinate what we call plasma. Another species of medical importance is Staphylococcus epidermidis, which is coagulase negative. So if we want to differentiate between the two species, because both of them are cocci, round shaped, both of them are gram positive, they stain blue. Okay, then how do you differentiate? So that the shape and gram staining is not able to differentiate. You have to go up to what we call a biochemical level, where that one is coagulase positive and the other one is coagulase negative. In terms of pathogenicity, which kind of disease can we expect from these bacteria, Staphylococci? They cause quite a number of disease, what you call suppuration or irreversible tissue damage, where it leaves a lot of scarring or scars. The most virulent one is both Staph aureus and Staph epidermidis. Okay, the other things about being alpha toxin. Okay, the pathogenesis part of it. These Staphylococci bacteria produce what we call toxins that necessitate to cause disease. These toxins, they will affect our cells, they will affect our organs, and by so doing, it therefore causes disease, sometimes diarrhea and all that. So that alpha toxin is very poisonous to us, and it also produces what we call enterotoxins and the famous food poisoning. When you hear people talk about food poisoning, food poisoning, food poisoning, the bacteria that is most responsible for that is Staphylococcus aureus. Staphylococcus aureus is the most responsible bacteria for what we call food poisoning because it produces what we call enterotoxins, which are poisonous and injurious when we eat. Um, this Staphylococcus epidermidis, it infect what we call prosthetic heart valves, or what we call the venous catheters, where now we people, as especially you colleagues, once you're in the hospital and inserting catheters in patients, whichever way, you are supposed to make sure they're sterile, you are aseptically maintaining them, inserting them, cleaning, to avoid this kind of bacteria because it's very common in heart valves or venous catheters. It can cause what we call subacute bacterial endocarditis when not checked. Also, another common bacteria we know of is what we call Staphylococcus saprophyticus, is a common cause of what we call acute UTI, and it's very resistant to novobiocin and naldixic acid. When you grow them, they grow what we call golden yellow pigment in what we call clade media, um, and all that. So, the following are the diseases commonly experienced or caused by Staphylococcus genus. Number one is what we call pustules or pistules. These pustules are small, inflamed, pus-filled blister-like lesions on the skin surface. So most of the time when you see some sort of small inflamed something like in terms of pimples, but when you press inside, you see something like pus, that tender in touching lesions on the skin, is a possibility that it's an infection from this staphylococci. Pustules on the skin surface are relatively common, and also like what we call are also common in what we call acne, and are the yellowish topped small pus-filled lesions that adolescents are notorious for picking and squeezing. So most of these things, because of the fatty, rich skin of adolescent people, you will see a lot of these sort of pimples or we call them pustules within the face, the chest, and even the hands. And I know most of these adolescents they keep on picking, pressing them, squeezing, and you realize that pus comes out of it. It's an infection of this group of bacteria, Staphylococcus aureus. These pustules may occur anywhere on the body, but it's common in the usual acne areas where the face, shoulder, back, and over the breastbone, and in areas of increased sweating, such as the groin and armpit, they can also be very common. Number two, you talk of boils or what you call furnacles. Funacle or furnacle, these are boils which are painful swellings of the skin which are some the body begin as red, tender swellings, which are bigger than actually the pustules and may later ooze pus. Some people have recurrent infection in this kind of thing. Apart from boils, which is also as a cause of Staphylococcus bacteria, we have what we call abscesses. These are localized collection of pus in any part of the body. Abscesses occur when an area of tissue becomes infected and the body is able to wall off, leaving some sort of an infection, you know, from the spreading. So this is where it's because of the white blood cells are trying to migrate to where the bacteria is as a way of trying to kill or destroy it. And instead, when that happens, if the white blood cells are destroyed, then pus is formed. Then we also have what we call carbagol. Carbagol is also a painful cluster of boils with a central well of pus, often found on the neck, you know, and it takes some time to heal, leaving some sort of scars. This one is also a common cause of skin infection by Staphylococcus aureus. Yeah, and then we also have what we call Agin vulgaris, which is most common form of disease, usually associated with the people in adolescent stage, as the way I've explained, but may also occur in elder people, depending. But it is primarily due to the hormonal changes in the body, um, but other factors that can also cause this agin vulgaris are like what we call when somebody is stressed or you use drugs for long, they affect the normal flora. So this staphylococcus can come in and cause this kind of thing. Uh, and perhaps also sometimes the nature of food that we eat. We also have what we call bronchial, bronchial is an inflammation of the nail folds, you know, where the acute pharyngia develops over a few hours when a nail fold becomes painful, red, and swollen. And then, if it's chronic, it's gradual and one nail fold, but often spread to several others. Swelling and peeling off the nail plate. We have stire, infection of one of the hair follicles of the eyelashes is also because of this Staphylococcus genus. It's an infection of small glands near the inner cornea of the eye. Okay, you remember those small pimple-like things that get swollen on the edges of the eyelashes, especially at the corner of the at the can we call it at the corner of the eye? That's what we call the stire, and it's an infection of bacterial infection of Staphylococcus group. Stitch abscess, minimal inflammation and discharge confined to the point of suture penetration where a patient has been stitched. If we don't manage that place well, it will cause abscesses due to the infection by Staphylococcus bacteria. We have decubitus. Decubitus ulcer or bed sore are as a result of local loss of skin and soft tissue due to prolonged bed rest. Those patients uh, who stay for or who are admitted to stay in bed for long, they develop what we call bed sores or what we are calling a decubitus. Decubitus ulcer is a result of this Staphylococcus bacteria. So it's common on buttocks and bony joints such as the heels, elbows, shoulders, and the back of the head. So this, when a patient is in the hospital for long, they are supposed to be, you know, protected from this kind of infection. Otherwise, even if it's at home, but if you are in bed for long, you definitely develop this kind of infection. It mostly affects elderly or infirm people who are confined to bed for long periods, including comatose patients whose condition prevent them from moving freely. Another condition from this disease we call embetigo. Embetigo, a contagium is an inflammation of the skin which is characterized by flat vesicles that becomes fistula, burst, and develop crust. You know, you remember the crust we were talking about from the virus, and this can form some sort of scaling. You know, that is again another. It could be from bacteria staphylococci. Mastitis, inflammation of the breast, especially during nursing. A mom, a lactating mother who has not taken care of, his breast well after giving birth. Maybe there's a lot of accumulation of milk, without frequently breastfeeding. Maybe you are staying away from the child for a longer period. That accumulation of milk, as they come out slowly, if we don't clean well, the infection of this staphylococci will come in, causing what we call mastitis. And it's also frequent site of both benign and malignant tumors. It can also cause what we call osteomyelitis. This is the inflammation of the bone or the bone marrow, usually caused by Staphylococcus aureus. And then also we have various streptococci that can also cause osteomyelitis, mycobacterial tuberculosis, and several fungi. So osteomyelitis is actually the inflammation of the bone. And among many microorganisms that can cause osteomyelitis, Staphylococcus aureus is among them. And of course, they can reach the bone joints through what we call bloodstream circulation. And then we have what we call Staphylococcus pneumonia. This is where the bacteria involved has moved through up to the lungs and is causing what we call pulmonary alveoli of the lungs, hence causing pneumonia that we call Staphylococcus pneumoniae. If this bacteria reaches the brain, it can cause meningitis when it affects the meninges. It can also cause cystitis. This is inflammation of the urinary bladder. It can cause infection of the urinary tract system, UTI, usually from the bacterial infection originating in the urethra, the vagina, or in the kidneys. So either of these organs, urethra, vagina, or in the kidneys, can be the origin of bacteria moving to the urinary bladder and causing inflammation, hence cystitis. The presence of this bacteria in the blood, it can cause septicemia, where is a high level of bacteria in the circulatory system, where if it's in the blood, we call it bacteremia, blood poisoning, bacteria in the blood.